Basic Life Support, BLS, is a set of emergency medical procedures performed to support and maintain life during a medical emergency. BLS is typically administered before more advanced medical care becomes available. It is crucial in situations where someone's breathing or heartbeat has stopped, such as in cases of cardiac arrest or respiratory failure. BLS can be performed by trained healthcare professionals as well as laypersons who have received basic training. Key components of basic life support include recognition of emergency. The first step is to recognize that an emergency situation exists. This involves assessing the person's level of responsiveness and checking for signs of breathing and circulation. Activation of emergency response system. Once an emergency is recognized, it's important to activate the Emergency Medical Services (EMS) system by calling for help. In many places, this involves dialing the emergency number, example 911. CPR, cardiopulmonary resuscitation. If the person is unresponsive and not breathing normally, CPR is initiated. CPR is a combination of chest compressions and rescue breaths. Chest compressions help circulate blood to vital organs, while rescue breaths provide oxygen to the person's lungs. Chest compressions. High-quality chest compressions are a vital component of BLS. The rescuer places the heel of one hand on the center of the chest, typically over the lower half of the sternum, and uses the body weight to compress the chest at least 2 inches deep for adults. The compressions are delivered at a rate of 100 to 120 compressions per minute. Rescue breaths. Rescue breaths involve providing artificial ventilation by giving breaths to the person in need. This is done after each set of chest compressions. The rescuer ensures an open airway, pinches the person's nose shut, and provides breaths into their mouth. AED, Automated External Defibrillator, use. If an AED is available, it may be used to analyze the person's heart rhythm and deliver a shock if necessary. AEDs are designed for use by both healthcare professionals and laypersons and can significantly improve the chances of survival in cases of sudden cardiac arrest. Reassessment. The rescuer continually reassesses the person's condition and modifies the BLS interventions accordingly. If the person starts breathing spontaneously or regains a pulse, the rescuer may need to adjust their actions. It's important to note that BLS protocols may vary slightly based on guidelines from organizations such as the American Heart Association, AHA, or the International Liaison Committee on Resuscitation, ILCA. Training in BLS is often provided through certified courses, and individuals who may be first responders or work in healthcare settings typically receive regular retraining to maintain their skills.